At an emergency COVID-19 ward run by charity Gift of the Givers in southern Johannesburg, medics wheel patients to their beds, rush from room to room with oxygen cylinders and pat the back of someone in grip of a coughing fit. The scenes in the converted community hall are a reminder of how badly South Africa has been hit by its third and most debilitating COVID-19 wave yet, as infectious Delta variant surges through a mostly unvaccinated population.
The Delta variant has caused enormous strain on the resources in not only private but also public facilities. So every hospital is getting strained, every healthcare worker is getting strained, and that is why this disaster management facility has to come up, and I hope it comes up in many places.
Fatima Lamba, the doctor in charge of the ward, says the Delta variant has put an enormous strain on all resources, including on healthcare workers. With South Africa recording an average of about 20,000 cases a day, the nursing active cases cumulatively of more than 10 times that, Africa's most economically advanced nation has also been worse hit by the virus with 64,000 deaths. The country's vaccination campaign has been slow, with just 4.2 million doses administered to a population of 60 million. Officials aim to reach a vaccination rate of 300,000 a day by the end of August. Doctors say they have never had to deal with so many COVID-19 infections all at once. Hospitals in the largest city, Johannesburg, where the latest wave started, are full. For 79-year-old Catherine Naido, the most terrifying thing about falling gravely ill was knowing that so many had died.
It was one experience because you don't know what laid ahead. You know, if you look at the news and see how people are going on, you know, passing away and things, it was the most frightening experience.
There are also fears the recent unrest seen in the country over the jailing of the former South African President Jacob Zuma could worsen the COVID-19 situation in the country.
As I said, shops have been looted and infrastructure has been destroyed. This means that our sick cannot get medication from pharmacies. Food does not reach supermarket shelves. And health workers cannot go to work. We will soon be facing a huge risk of food insecurity and medication insecurity in a few weeks. Our vaccination program has been severely disrupted just as it is gaining momentum.
President Cyril Ramaphosa extended COVID-19 restrictions on Sunday, July 11th for another 14 days, including a ban on gatherings, a curfew from 9 a.m. to 4 a.m., and a nationwide ban on the sale of alcohol.